Active hands. Do you have active hands? We were actually away last week in Washington, and a child who had traumatic brain injury. This was something that was the only thing that can help calm her when she was overstimulated from the environment.
Hi everybody, it's Mr. G from Channel 11 News, and you know me for 4 decades plus. I'm at Cohen's Children's Medical Center here at Northwell Health, and I'm with 2 remarkable women who are doing a remarkable program that we're going to kind of chat about. I'll give you their names.
Sharon Goodman.
And?
Jennifer Simonetti.
You have a remarkable program, and I was told you guys are joined at the hip. So tell me how this relationship got started.
So it started actually with a patient. So it was a patient who came to us. They were autistic, nonverbal, and they actually came to us in restraints because they couldn't control their behavior. So we called the huddle, which is what we do usually on the units. We'll call a huddle, have all the interprofessional team there, and someone said, I don't understand. She goes to school. She must communicate somehow. She functions. And from there, we investigated further, and we found out that she did communicate. And through that, we got her communication device from the school. They let us use it. And from there, we were able to communicate. She went to the playroom. We got all her testing done, and we got her discharged.
What signs did she show when she didn't have her device to communicate? What was happening to her?
She was in the fight or flight. She had fear behind her eyes because she couldn't communicate with us. And as healthcare providers, we're here to do, what's in the best interest of those patients. And in that moment, we knew we needed to do better for her.
What does Be Mindful mean?
So Be Mindful is a program that was put together to help patients like this one who have neurodiversity, so autism, ADHD, sensory integration issues. So it helps support them while they're here in the hospital so they can get the treatment that they need.
What happens to people who are a little of this and a little of that? And that may be everybody in this room. I mean, they're not all clearly on the definable spectrum. What happens to them?
It's a great question. You don't have to be formally diagnosed to be in this program. Maybe it's something that we see that the parents or the caregiver doesn't see. Maybe it's something the parents said that this is what Sharon does all the time, and we can help support those behaviors. So for someone who has anxious hands, we're not going to stop that. We're not going to try to hold you down. We're going to give you something safe that you can continue with those self-soothing behaviors.
The Be Mindful program begins to take off. And what has developed in the last 7-8 years?
So the program is basically like 4-tiered, I would say. It has education, so we first educated everybody that has a touch point with the patient and the family. So that's everybody from the kitchen, from who removes the trash in the rooms, to the doctors, to the surgeons, to anesthesia, to the nurses. So we educated them on the understanding of what it's like to be in an environment like this for someone on the autism spectrum or with neurodiversity. And then from there, we created a PNAT tool. It's a validated tool that we use to capture all the necessary information that we need. What are triggers? What things can we do to make it better? And then we communicate that out through our electronic medical system. We have a sign that stands on the door of every patient's room. So before you walk in, you're going to see the Be Mindful sign.
Hold up. And what is that Be Mindful sign is?
It's beautiful. It is a heart. It is a honeycomb shape with a little bee. And really it's to show that we are bringing everybody together. We're clustering the care. We're making it a safe environment for you, for your child, for your loved one, for the patients, for the families, for the staff.
It's a darn good life, and it's kind of funny when the bee meets a bee and the bee meets the honey, and the honey, I don't know. I call it honeycomb.
There you go.
Honeycomb.
Don't know that one. Honeycomb. I do like honeycombs.
Honeycomb is the magic, isn't it? It's the bee with the honey, and you found the cone.
We did. And, if you think about a concept of a bee, bees work together.
Are the kids aware that they're calming down?
Yes. You can visibly see the stress relief from both the child and the family. You know, they come in here for usually a medical diagnosis, not because they're autistic, not because they have ADHD, not because they have something that they don't even know that they have. They're coming in for a medical reason, and they don't have to worry about us supporting their needs. So through that PNAP tool that Sharon talked about, it really does define what works and what doesn't work for that child. And from there, we're very lucky. We have what we call the Be Mindful cart.
Whoa.
And just as vital as a crash cart is to save someone's life for cardiopulmonary resuscitation, this is just as vital for somebody with neurodiversity.
Now, Now, go back to what you said. She said this is almost like a medical toolbox.
It is a medical toolbox. It's actually a crash cart that we use to resuscitate patients, actually the same device. And then we filled it with all necessary equipment to help our patients, support our patients while they're here for their procedures.
So remember I told you when I was growing up, because of circumstances, I was one of those kids without a toolbox, right? So the carryover is dentist. For me, it's not good. Going doctors. Another guy that doesn't like to go to doctors. And other stuff. Hold this.
Yes.
So you gave me something for my dental visit.
Yes, we did.
Yes, we did.
Saying, this is my, why are you laughing? Well, anything's an improvement, I understand. So how does this represent something to an anxious kid who doesn't want to go to the dentist?
Sure. Think about your experience. You go into the dental office, you sit down in a chair. What's the first thing that comes?
Light.
Light. And that could be a trigger on that PNAT tool that Sharon talked about. These are things that we identified. So we give them the sunglasses preemptively so they can put it on and it's not that harsh intrusion into their eyes.
Does it work?
Absolutely.
Ongoing?
Ongoing. Absolutely.
So the trigger is, are they so emotionally tuned up that even light sets them off?
Yeah. You know, that bright light. Noises are a big one too. We have noise-canceling headphones. We have a lot of children who, need sensory input, so they may rock, they may hum, but during a procedure you need them to stay still, so we can provide that.
Wow. Let me ask you a question. I don't think this goes beyond me thinking this way, but isn't this a strength when they're so tuned up? Isn't this a strength that a lot of people who tune out don't have?
100%. Absolutely. We always talk about, it's just the uniqueness. It's neurodiversity. It's just the brains are a little bit different, and sometimes it can be really a positive thing, Absolutely.
Really. All right, so we have the toolbox. Why don't we, thank you.
Sure.
These are my Look Smart glasses. Hold it. Do they work?
Smarter.
Sort of.
Jennifer.
Shut it. Why don't you meet my wife? She does this to me all the time. You hear what she said?
You said
sort of.
Smarter. No, I said sort. I said no, smarter.
Okay. Now, tell me what works here.
So sunglasses for sure.
Right.
Okay. For fidgeting hands, Jen showed you the tangle. So if you're having a procedure done, you can sit there and do your tangle.
And is that a relaxant to the anxious mind?
Yeah. Some people, just being able to do this allows them to focus or to be calm, to sit for a procedure. I like to do it just when I'm talking. It makes me feel nice and at ease a little bit.
What else can I take to the studio?
You can take it all.
No, go ahead. I'm so curious about what really works. Go ahead.
We listen to them. So what works for one may not work for another. What may soothe you may trigger me. So every person is different.
Oh, wow.
And that's why we have this full card of different items that may work for one, which may not work for another.
Let's take out something else that you think. It's a snake.
It's a snake that vibrates. And you put it around your neck. So if I'm in the dental chair or if I'm having a procedure done, and I'm someone who likes to rock or move, right? I can't do that when they're doing a dental procedure. That would not be good. So this allows for that sensory input, so it vibrates, and then they can stay still.
Wow. What do we got here?
Weighted blanket. So when you're sitting, this helps give that sensory input. So you ever hear of weighted blankets at home? A lot of people are buying them in the store. This is very similar. It helps give that sensory input that helps
While
them
they're
stay-
sitting still. They
So
hold
they-
it in their hand.
Yep.
Hold the mic.
You got it.
Or you can have it on your lap, when you're having a procedure.
You can put it on your
heavy,
chest, wherever
on
you
your
seek that
chest.
input.
Wherever you want to put
Wherever
it.
you want to put it. And if you're laying flat, that'll give you. Some children like to burrow under things because they seek that heavy input.
Oh, so it's like a blanket, security blanket,
Similar.
or not, so depending on where they want to put it.
That's right.
And then they can squeeze it.
They could do anything.
And
yeah.
they can do anything that triggers something. I'm so much a believer in this. I'm so much, you know why I'm so much of a believer? Because people keep talking and everybody stops listening,
That's right. That's right.
even if you're smart.
That's right.
So all of a sudden you have something that's triggering something in your brain and it works.
Yep.
Ah. Okay.
Thank you.
Who went to Washington here?
We both
We
did.
both did.
What did you do in Washington?
We worked with the Children's Hospital Association for Family Advocacy Day, and we were able to advocate to our legislators for the need for sensory rooms, for the need for this program to be spread not only in other children's hospitals, but in schools and other community venues.
How were you received in Washington? How were you received by the other hospitals?
We were well received. Everybody, I think, knows somebody who has autism or ADHD, and they want to do.
One out of every 25 kids?
Yeah, everyone has a loved one, and they want to do the best for them, and they've experienced, the difficulties of coming to the hospital or bringing their loved one.
When you say do well, did you get more funding?
We are in the process of looking at different funding, but we've also got a lot of interest from other children's hospitals across the country, which is really our main goal, is to spread this program to as many people as possible, so to make everyone's lives just a little bit easier.
Where do you see this program spreading?
Everywhere.
Everywhere.
Everywhere. We've been very fortunate. We've spread this to UBS Arena.
What do you do with UBS Arena?
We partnered with the New York Islanders and UBS team to build 3 identical sensory rooms in the arena, and we were able to educate all their guest services team members. We provide their annual education.
So the kids can go and enjoy themselves.
Anybody can go. So it's built that anybody, no matter if you're a child or if you're a geriatric patient, it's across the entire lifespan.
You mean the kid can go to a hockey game and still enjoy the game
That's right.
if he's in the room?
That's right. And you know what? He doesn't have to go on a designated Autism Awareness Day. He can go on a Tuesday. He can go on a Friday. He can go any day.
Wow.
And the family unit can go together. They don't have to separate.
Wow. You got an award recently?
So we got the ANCC
ANCC.
Magnet Prize Award. So it's awarded to one magnet facility each year, and we were awarded the 2020 award for our Be Mindful program. We got some funding from that, and from that we were able to, create the Be carts and spread them throughout our hospital, spread them throughout areas in Northwell as well. So it was very, very exciting.
Do you have parents who want to take some of this home?
Yep.
And what do you do with those parents who request this or this or this?
We give them a Be Mindful bag. It is for them to use. It is not reusable. We definitely encourage them to take this home with them, so their car ride home is successful, their school is successful, whatever they need it for.
Be Mindful bag.
That's right.
I learn something all the time, Brian. I don't know. I learn something all the time. So what we're learning from this is be mindful of your own mind. Stop talking and figure out what's going on in their mind to calm them down. That we don't have the answers by just lecturing.
Absolutely. We have to figure out what the secret sauce is. I always say, what that individual needs. We have patients sometimes where the gowns are really a trigger. They're rough, they're hard, they won't
Yes.
put them on. I had a patient who, they loved the gown. They loved to hear the sound of it and the crinkle of it. So that was an aha moment for me to understand everyone is an individual, So I hate the gown too, but Jen and I, we're just so thrilled so many years later to have been able to touch so many families, so many patients. When Jen and I started this program, and she knows what I'm going to say, we said if we help one patient, we've done our job. And
That's
we've been able to
We
help.
said if one person does not leave
That's a
traumatized,
religious
then
axiom. it's a real.
Successful. And we've helped thousands, not just here in our local area, but across the country. Sharon and I, we've been able to spread this to, we like to say we're coast to coast. We have hospitals throughout the entire United States that have adopted the program and have really changed how they care for not only children, but adults, patients with psychiatric diagnoses in psychiatric facilities, patients with dementia. So it really provides that safety, that securement for anybody.
We want all children's hospitals across this country to utilize this program.
Well, you're on your way. You're living your legacy. You know the expression, right? If you save one life, yours was worth it.
That's right.
Well, this is thousands of lives.
That's wonderful. That's beautiful.
Is there something that you would like to see moving forward in the B program? Is there some further enhancement in 3 or 4 or 5 years that you could put in the gift bag, you think?
We've really started to spread out into the community. You know, we really think it's important for family wellness to bring programs that are started here in the hospital out into the community so they can enjoy, you know, everything that, you know, we do as a family unit, as a group. So we just want to support them wherever they are.
Do you want to ask me any questions before I steal all this stuff?
Well,
Look, my hand doesn't shake anymore. Look at that.
Since we've diagnosed you, we can provide you with a B card.
Yes.
That's it.
Here you go.
What's this?
When you enter the facility, you can be expedited through. So even security, our concierge team will say, oh, this is a Be Mindful patient. So that just helps them come through. And
it's one of our big goals. I'm going to interrupt you. It's going international.
Okay.
So supporting our international colleagues across the oceans and really just spreading this best practice that came from our children's hospital, Northwell. And
have you been in contact with hospitals overseas yet?
We have. We have started conversations with several different countries. They're not just pediatric specific. They're adult and pediatric. So we're very excited.
What countries?
Germany, for instance, yes.
They are interested?
Yep, highly interested.
You've mapped out the brain.
Yep.
Absolutely. Mm-hmm.
So I can imagine everybody be interested.
Absolutely.
Okay.
Cool. That is our goal.
I am
You're
steady
taking
of
that?
hand. Wait, steady of hand.
You can have
I
that.
can now go to the dentist.
Right.
I can be mindful.
When you come in.
Be mindful. I can relax. I can pop little bubbles. And then when somebody yells at me, I could put this on.
Tune it all out.
Hey, when my boss talks to me, I can put this on. This is perfect.
That's fantastic.
Final note. Tell me what you'd like all parents to know out there in terms of Northwell, its program, the gift bag, and Be Mindful. What do you want all, and you can speak to the camera on this.
So I want all people to know that they can come to our facility. They can come to any Northwell facility and be supported in their needs. If they have a loved one who's neurodiverse, we are here for you. We are here to help you. You know, coming from medical care can be challenging. You may have had poor experiences in the past that make you reluctant to want to come to a facility, but just know that here at Northwell, here at Cohen's, and throughout, we will support your loved one. We will help them get the medical care that they need in an environment that is supportive of them.
So I just want to take it one more step. For the parent at home with an anxious child who's acting up as they watch this, and they're trying to get them under A, control, and B, maybe get to the hospital, what can they do right now watching you?
They can definitely reach out to us. They can go to BeMindful.com. We have a website. They can email us. We can definitely get them in touch with whomever that they need to make appointments with. We can help facilitate their entry into the hospital. We can make team members aware of their entry. Here, Sharon and I are very supportive of education. And like she had mentioned, we educated everybody. But really, we educated everybody from our executive director to our nurses, to our physicians, our ancillary support staff, the kitchen, environmental. And that really does make the program all-encompassing. So everybody is aware. There is no pocket of nobody understanding.
I want you to react to what I'm going to say,
Yes.
and this is the final thing.
Okay.
Why don't you react to this? This is not only going into the doctor's office. This is not only perhaps for surgery, dentist, whatever. This is afterwards too.
Right.
that
right.
after the procedure's done, those triggers are still there, and this gift bag still works.
That's correct. That's correct. Coupled with the individuals who are highly trained using these modalities, we really can make your postoperative experience or your surgical experience, your recovery time that much smoother.
Absolutely.
Is there anything in this box that would make me smarter? Listen, I want to thank you both. I think it's a great program.
Mr. G, before we go, can we just bring in our
Sure,
colleagues? Because
sure.
they really do help us drive this program
Sure.
every day, and they are just as passionate as we are.
Yes.
So I'd like to bring out Taylor and Laura, who really are driving forces behind this program as well.
How'd she do, by the way? How'd she do?
Outstanding. Outstanding.
And
Gold star.
how'd the other one do?
Outstanding.
They're both stars.
Both stars. Now, if we can get one more star here, that'd be great. What did you learn about them today?
I mean, just the way they speak about the Be Mindful program, it's always so inspiring to know the dedication and the work that goes into a program like this, and it helps to reinvigorate us to help push it out to the units and make sure that the children get the care.
Thank you.
Never too late.